Hello and welcome to Paincast, Conversations on Pain and Physiotherapy. This podcast is brought to you by the Pain Science Division of the Canadian Physiotherapy Association. I'm Tiffany, the producer of Paincast and an executive member at the Pain Science Division, and I'm practicing physiotherapy in Toronto.
I'm Julia, a physiotherapy student at McGill University and a member of the Pain Science Division Student Committee.
I'm Ispa, a physiotherapy student at the University of Saskatchewan, also a member of the Pain Science Division Student Committee.
What can music do for pain? How does it affect each aspect of the bio, psycho, and social to improve pain and overall health and wellness? What does the research say about music therapy? We're excited to share our interview with Dr. Amy with you to talk about how we as physiotherapists can see music as one of the tools to manage our patients' wellness.
Before we jump into the interview, as a reminder, Paincast brings together researchers, clinicians, and students and patients to facilitate discussions, knowledge, translation, and critical thinking on topics about pain and physiotherapy. The views expressed in each episode are of individual guests, do not constitute medical advice, and do not represent the views of the Pain Science Division or the Canadian Physiotherapy Association.
Enjoy the interview.
Hi, Amy. How are you doing today?
I'm good. Thank you so much for having me.
Thank you for being here. To start us off, can you introduce who you are, what you do, and what a typical week looks like for you?
I work currently as an associate professor at the University of Toronto in the Music and Health program. And I also teach in the music therapy program at Wilfrid Laurier University. So I'm a music therapist, and I'm also a psychotherapist. And I have a specialization in a few areas with respect to different music therapy approaches. So that being neurologic music therapy, as well as behavior therapy within the psychotherapy realm, and also advanced training in the Bonny method of guided imagery and music. So I use all of those different approaches in my approach as a therapist. I do still do some clinical work, but I'm very fortunate in my roles teaching at the university that I still supervise students doing their placements. And I know you're going to ask me a little bit more about who I work with.
That's wonderful. You're very experienced, clearly. Would you be able to help our audience visualize what music therapy is by walking us through and talk about what it entails, or walking us through a typical session?
Sure. So music experiences exist on a continuum. So we have music that we use for ourselves every day, right? You probably turn on some music if you're driving in the car. I turn the radio on and that energizes me. But that's not music therapy, but it has therapeutic benefits. So there's this continuum of experiences, things like entertainment, going to a concert. Music therapy involves the music as the tool, but then you have the music therapist, you have the client, and you have the relationship that's happening and the client that comes with a need. And so the music in collaboration with that therapeutic relationship is what's affecting change. So a session can look so different depending on who we're working with. I'm fortunate to work with individuals across the lifespan. For someone with dementia, for example, that's one of the areas I specialize in. A session might begin with a greeting song of some kind to orient the person to what we're actually doing. I might sing some preferred music, like a couple of songs to engage them, but I'm always thinking very goal-oriented, like what are the goals that we're going to be accomplishing in this session? So we might sing some songs, we might improvise music, we could be looking to do movement to music, so many different experiences. And so perhaps with some of the research and clinical examples, that'll become clearer to everyone.
Well, that's really interesting to see the distinguishment between music and music therapy. So who are the typical recipients of music therapy?
So yeah, we're so fortunate, in this profession that we work with people across the lifespan. So right from the neonatal intensive care unit right through to end of life. So as I was saying, my specialty has been in dementia, has been with older adults, as well as palliative care, as well as individuals with a variety of mental health needs. but we are also working with children and adults on the autism spectrum. We work in schools, we work in hospitals to help people that are recovering from stroke, in rehabilitation. We work with speech and language deficits. We work with individuals diagnosed with other illnesses such as cancer, working to help people with pain perception. And then sometimes what's forgotten is we also help people with their wellness goals, right? So not only looking at healthcare kind of as a reactive approach, but also preventative. How can we be using music therapy to help us in terms of preventing or maintaining some of the function, and so that things don't increase or become more debilitative?
And for these populations, is there a standard referral process, and does it differ in different settings?
Excellent question. Referral differs so greatly depending where one is working. So as a music therapist, I might work in a hospital. And so then my referral might come from someone on the interdisciplinary team, like a physician or a nurse. If I'm working in the community in a private practice, that referral sometimes comes from the caregiver, might come from a social worker or a caseworker that thinks to suggest that. If I'm working in a school, it might come from the teacher. So it really depends. And then if you're fortunate to be in a position in a hospital or a hospice, for example, you might actually be the one that is doing the referrals. And that's very typical, where you are building the caseload as the music therapist, identifying the highest priority needs to provide service to first.
A few curious questions to, again, help audience visualize music therapy and what this is and how does it work. Usually when people receive a referral for music therapy or being referred to music therapy, are these people who are already interested in music, who already like music, or that doesn't have to be a criteria?
Oh, that's a fantastic question, because a lot of times the referral might come from people that don't know a lot about music therapy. So the person might say that they like music and they think, oh, music therapy, that must be what's indicated. But people do not need any musical experience. And in fact, many people are not musicians, although I've had the fortune to work with musicians as well, because our goal is not to teach people to play an instrument or to make music, even though we are making music. And I fully believe that everyone has the potential to make music. And so it's viable for everyone that desires it. People, it really does depend, in the hospital setting, for example, or clinic, it might be that music therapy is offered where someone might not even think to seek it out. And then in private practice, it's quite different because people are actually typically actively seeking out. So they may already be wanting to do music therapy, very committed and know more about it than sometimes people in the other situation who might learn about it and become interested, but may not have actually thought about it themselves.
Let's say in settings where music therapy is offered, how would a music therapist typically introduce music therapy and why this could be beneficial to the patient?
So typically we would talk about why we received the referral, so-and-so, I received a referral because I understand, for example, you're experiencing a lot of pain. So then I would maybe explain how I could help them, how music could help in this, maybe share potential goals and ask them what they think about this. And certainly we run through a formal consent process, and consent is different when we're doing music psychotherapy. We really make sure that people understand the risks and the benefits that they are agreeing, and that's ongoing, right? That's an ongoing process where we're always ensuring people are consenting. And then, of course, we do work with vulnerable individuals and individuals that are no longer able to give their consent. And so that consent is sought from a substitute decision maker. But I very much believe in explaining what we're asking people to do, whether they are the person providing consent or not. And there are very easy ways, I think, that we can see if someone is consenting to the process, and we can check in with them in that way.
So you mentioned goals a couple of times, and this is something that I guess haven't completely realized about music therapy, that it is also quite goal-oriented. Can you share a few examples of what these goals are and how you would tailor a music therapy session for a specific goal?
Sure. So we have goals in all kind of the domains. I think that's also the beauty of music therapy, that we're able to help people in the physical, the psychosocial, the spiritual domain. So it's very holistic. So, a typical goal would be maybe to help reduce pain perception, to provide an outlet for emotional expression. It could be to help regain speech or fluency of language for someone that has had a stroke. So we always do an assessment at the beginning of the process where we find out where people are. That serves as our baseline. I very much am client-centered. I want the client to also share with me what it is that they want out of this process, what they're hoping to work on. We should never assume, because someone has been referred for speech and language, for example, if they had a stroke, that's the only thing that they want to work on. Maybe they have psychosocial concerns related to the experience of the stroke, and they may want to use music to help them express what they've lost and grieve. So it's very important to listen in that way. There's just so many examples, of how I might work. But if someone, for example, in palliative care really was, working through and looking at some of their losses, we might actually write a song about that to help them grieve those losses. We might improvise to music to help them express how they're feeling. There's a lot of different things that we can do. We can use music to help people gain a better sense of identity. If I was working with a stroke client, perhaps that has aphasia, it might be a very specific goal, which would be perhaps to regain a certain amount of words. And then I would apply a specific technique, perhaps like melodic intonation therapy. And so we have very specific SMART goals where they're measurable, they're time bound. We've got objectives on how we're going to reach them. So depending on a music therapist's approach, the goals can be written in a little bit of a different way. In the neurologic music therapy approach, the goals are very concrete, and we're looking at how music impacts the brain, right? And how music changes the brain, and that's how changes are in fact happening. So we're very aware of what we're doing in music and how we can make those changes and help people if that's what they desire.
So reducing pain is one of the goals for music therapy, and pain is a biopsychosocial framework. So music therapy is a unique approach that can address all three of those components. So Amy, to start us off, can you briefly introduce your music therapy research in people living with dementia and people in palliative stages?
Sure. So my research has really been quite different in the different areas. I get really excited, and I think the best research questions come from the practice. They come from when I see if something's working well or if it isn't, and I want to understand that phenomenon. So one of my earliest studies was actually on pain perception in individuals in palliative care. And we were looking to see if live music or recorded music would help people in reducing their pain perception and enhance physical comfort. So that study spanned over 2 years, because it is quite challenging to get participants in palliative care, people at end of life. People may die before they complete the study. People can often be in various stages of consciousness. So ethically, it can be more challenging to secure participants. So what I found from that research was actually not something groundbreaking that I didn't know. Of course, music helped people reduce their pain perception, and live music was more impactful than the recorded music, although it still had an impact. So from that study, I really changed my course of research, and I wanted to really start understanding about the experiences of people, in addition to understanding that quantitative information about, yes, my pain reduced from a 5 to a 1 or a 5 to a 3, but then why? Like, what was it about this music that helped you or, made the experience so that you did perceive pain less, So from that, I really started looking at doing more mixed methods research, where it was kind of combining some of that more statistical information with finding out about the specific music, what specific techniques were helpful. So some interviewing, that sort of thing. One of my big studies in palliative care has been on relationship completion, which doesn't necessarily, focus on pain. But if you think of pain, for example, very holistically, as you were describing, that people can have like existential pain at end of life. They can have a lot of psychosocial pain in addition to that physical pain that they can experience in palliative. And so that study looked at, is music helpful in people to help them complete relationships with themselves, relationships with their significant others, relationships with a spiritual entity or God or a higher power. And so it's not that the relationship ends, that, it's done, because sometimes people are taken aback by that word, but it's more that the relationship comes to a place where people have expressed the important sentiments that they need to, such as, I love you, thank you, please forgive me, I forgive you, and goodbye. And those are sentiments that Dr. Ira Bjork has written about, I believe, in around 1997, a US physician. And so his work inspired me to take this on because no one was looking at this with respect to how music might help. And so I really found in that study that music was very impactful in helping people. And so people wrote songs. I had one lady in particular, one client who had written a song cycle. So we looked at the important stories of her life and her marriage. And so we wrote songs from the different time periods and did a life review. And we also selected songs that reminisced about that time. So, for example, there was a song that her husband had taken her to Paris for an anniversary, and we picked La Vie en Rose. And so that whole song cycle, along with original songs she wrote, we presented as a concert for Jack. I recorded all that music and then learned about the experience for them, how that was helpful for them saying goodbye. So the husband, in this case, was also a participant to learn about what that experience would be like in terms of helping them grieve. So it is a very holistic. And this client in particular had extremely bad pain, which I haven't seen as much, like physical pain, because palliative care, people are well controlled with medications. We do have a very good system in terms of medications to support people. But this client in particular suffered, and I think a lot of their suffering was also the existential concern and the psychosocial concern, which also manifested into physical pain, right? Which makes sense. So that's one area of research. And then in a very different realm in dementia care, some of my studies have looked at singing for health and wellness. So how people can engage in choirs to help them with various parameters, such as pain perception, so reducing pain, enhancing mood, providing opportunities for socialization, happiness, energy. And so those were also mixed method studies, which kind of evolved in terms of the stages. So it was a multi-phase study, which began with people that had a mild cognitive impairment or were cognitively well, older adults. The second phase focused on individuals with mild to moderate cognitive impairment living in a nursing home or in long-term care. And the third phase focused on individuals with moderate cognitive impairment attending the choir with a caregiver, so a significant other. And we wanted to see if there were also those same benefits possible for those individuals, so reduced pain. And I had statistically significant results in phase 2 and phase 3 of my studies for reduced pain, enhanced mood, increased energy, reduced anxiety, really very positive benefits from a very low cost intervention that is not harmful in terms of there are side effects of music and we must use it responsibly. But when we think about the benefits that come from that engagement over the cost, it's silly that we're not doing more music in some of these spaces, I think. And what, is so impactful is, this music doesn't just impact the patients and their caregivers, like the familial caregivers, for example, it impacts the environment. And it changes when people walk by and they hear music. That environment is changed. So when we play music in spaces where others are coming to receive treatment, for example, it changes that environment. It can boost the morale of the staff working there, of the allied healthcare. So, sorry, I've kind of gone off on a tangent. I get very excited, but So definitely, I mean, my research has focused on that. And then I could go on to talk also about vibroacoustic therapy, but really passionate about using music in a very holistic way.
Thank you. What I'm hearing is that music has very positive effects on different levels. So the personal level, where they experience, let's say, changes in the brain, changes in their physiology, mood, health and wellness, and then the surrounding caregivers and the relationship between themselves and the next layer, the caregivers, the relationship aspect of it, and how caregivers are able to come to negotiate and reconcile with what's going on, and then the environment where the whole center where the music reaches, there is an effect, which is, oh my God, like that's a very, as you said, a holistic way and holistic benefits that music therapy can offer. And what you were talking about with the existential pain and loss of relationship, that reminded me of one interview that I did. It was episode 22 or 23. We're having a philosophical discussion about what is pain and what is suffering.
Mm-hmm.
And the theoretical framework that they came up is there is different levels of self. There's a minimal self where the physical needs are met or not met. And then the narrative self, how you understand you to be, and the existential self. And when these self are jeopardized or threatened, that's when suffering happens. And I feel like music therapy is one of the ways where these levels of self can be healed in a way.
Mm-hmm. There's a model of music therapy that I use. It's by Dilio and Denister. And so it's at 3 levels. So we can provide music therapy and palliative care at the supportive level, at the communicative and expressive level, and at the transformative level. And that really aligns with what you've just spoken about. So at the supportive level, it's really to help palliate the symptoms that are very common. So pain and anxiety, right? So if those things are not controlled, if someone has very, intense pain or anxiety, they can't get to the next level. Like that has to come first, right? So we are able to use music at that level. And then if someone is desiring to express more about the experience, wants to share, explore their emotions, that's where that next level, properly titled expressive communicative, comes into. And then again, if someone has the energy and they desire to do transformative work, that's the next level where people may work on relationship completion. They may be planning their funerals. They may be talking about medical assistance in dying. We may be helping explore that. We may be there to support that as well. There's a new role for music therapists who may be called to support someone that is desiring to discuss their wishes for medical assistance in dying, or even to be part of that MAID process. And I should maybe just for your international listeners, so medical assistance in dying is what we call it in Canada, but that's also known as physician-assisted suicide in other areas of the world.
Mm-hmm.
This model has been helpful to me. And it's not like it's linear. It's not that you go from one to the other, but it helps me conceptualize where I'm going with the client and where they want to go in the process. And so many times I've seen as health deteriorates, that we may have peaked and actually done some transformative work. And then if I have the privilege of being with them, we may end up leaving it on the supportive level where I might be actually providing music as someone is actively dying, right? And their family might be present in that space as well, supporting that transition to their next place of being.
Yeah. So we're discussing right now the effects of music therapy on the psychological and the social aspects of pain. I guess the audience might wonder, in a music therapy session, how much is music and how much is there talking?
Oh, that's $1 million question. And it really depends on the music therapist and their approach, because some music therapists, especially if you are a psychotherapist, perhaps you're more drawn to using a bit more verbal dialogue in collaboration with the music that you're doing. Someone that comes from a more Nordhoff-Robbins approach might only really be doing music and improvising. So there is much less attention paid to the discussion. We have to remember that music is our tool. That's what makes us special as music therapists. So at the core of what we're doing is the music. So the music should be the instigator. It should help us to unpack things. And sometimes we unpack those verbally when we've had a music experience, but we can also sometimes unpack them musically. So I really take my lead from the client. And for me, it is a mix of both. And at the very core, the work is about relationship. It's about this relationship that I have with the client as the therapist, but also the client has with their music, and then that we have with the music together that we're creating. As we all know, music creates a bond and it helps people feel connected very quickly. You know, if one really simple example that I think helps people understand that is if you go to a sporting event, like a baseball game, and at the 7th inning, everyone sings, you know, "Take Me Out to the Ball Game." You can feel very connected to these people you've never met across the stadium because you're all singing something together and it can be moving and you can, you know, your emotions can be changed. So in music therapy, music helps create the bond often very quickly between the client and the therapist. And music acts as a container of our emotions as well. You know, similar to like music language, we can have like codas and finales in the music that kind of sum up things, right? And help things stay contained and become expressed. So it really is very different. I wish I could give you a harder answer, but I think that's also the beauty of music and psychotherapy, which can be challenging in research, is that a lot of times we're not following a specific protocol because we're really being client-centered and the client is driving what's happening. So I can have a protocol, like I can certainly have theories that I'm following and techniques and the interventions, but I also have that ability to divert from a protocol to be with my client that needs me. And if they don't need to work on the specific intervention and they need me to help them walk down a path where it is to explore how they're feeling that day, then that's where I'm going to go.
So I'm hearing that music therapy is very client-centered, and I'm wondering, as the music therapist, how do you decide based on your client if they'd benefit more from listening to music or creating music, and what kind of populations you've observed benefit from either?
So again, we always try to involve my client in deciding what they'd like to do, right? So I don't go in with a kind of like, you know, I think they'd like to sing, so, or they might like to play, but I offer a variety of experiences. And then just like in anything, you come to know maybe what people like or prefer more. When I don't know someone and I'm doing an assessment, again, like I try a variety of things to get a sense of what they might like. I certainly ask their input on what they might like to do. Now, some people can be shy. You know, if I suggest songwriting, they may say, well, I can't write a song, I'm not musical. And it's all in how you present that opportunity to help them engage. So again, I'm taking my cues from them. I'm offering them lots of variety. Also, I'm a very eclectic practitioner, so I also believe in bringing in other tools that might support me. So bringing in images to look at that might spark conversation and help reminiscence, for example, with a person with dementia. They may help orient us to the time of the year, and I would bring that in collaboration with the music.
So you mentioned that in both areas of the dementia and palliative care studies, you try to take a mixed methods approach. And I wasn't sure if we already talked about the findings from the quantitative side and the qualitative side. Like, what are the themes people bring up? I mean, we talked about relationship completion. Is there any other ways they find music therapy to be helpful for them?
Yes. So, I mean, in the dementia studies, we did have themes that came about. So, those were things like music helps me feel connected. It provides a sense of belonging. It's something that everyone can do. It's fun. It reduces my anxiety, which is an interesting one because sometimes people don't actually rate themselves as having anxiety, but experience it. And then talk about how it is so relaxing and fun to participate in this. With the relationship completion, you know, some of the themes were love, loss, goodbye, thank you. Like they were kind of the sentiments that came out that were themes in some of that research. But definitely we find that it really depends what people are getting out of it, and the experience is different for everyone. And that's, I think, the beauty of it as well, right? People get different things out of the experience.
So yeah, I mean, it's another point to illustrate how even affecting how they relate to one another or how music affects their anxiety can have an effect on pain levels. Would you say so?
Yes, yeah, for sure. I mean, if we think about many healthcare concerns and stress, for example, who doesn't have stress? And it manifests itself in the body. People can have very complicated issues from the experience of stress and pain. And so, when people maybe feel more connected to their identity or have experienced endorphins from singing and in the oxytocin that comes from that experience, or we're initiating the relaxation response, which can happen with music, they can then think less about their pain, and the experience is different, right? Because your attention is maybe diverted, maybe you're feeling more positive about something. And I think Julia had mentioned that it's very client-centered, and personhood is very important in the work that we do. And connecting with identity, especially for people that have a dementia where they may not really present as the person that they used to be, right? And so preferred music or music that is in their long-term memory can sometimes help them participate very actively in something, and they're focused in something that's engaging, and you can see that there's enjoyment. I had this one client who had a lot of pain because she had pressure sores. And so she stayed in bed a lot of the time. And she actually only got up to come to music therapy one time a week. And the other times she was confined to her room. And she would get up if she had a medical appointment. So it was very rare that she got up. And that was not because they didn't want to get her up, because she had these pressure sores and it was difficult to support her in a chair that was comfortable. So I visited her in her room and had individual sessions with her. But then she also came to the group, and I questioned, at times, was it right to have her come? Because as she was waiting, you could see that she was in pain. But as soon as we start the music, it's like a different person. She's engaging, singing, actively talking to people. And before that, she was really just looking down at herself, complaining that she had pain. And then all of a sudden, with the music, for like 45 minutes, she's actively looking around, and, we don't see the pain being expressed there, right? Like there's a complete different engagement in what's happening. The one challenge we have that, is not solely with me, I think, and it's with other allied healthcare professionals as well. When we work with people that have dementia, they sometimes can't share with us where the pain is, how bad the pain is. And so the pain might manifest itself as behavioral and psychological symptoms of dementia. So it could manifest as agitation, as anxiety, aggressiveness, wandering, calling out, because there's something that's not right in their environment. So it could be pain, it could be a lot of other things. They're responding to something that is in the environment that's bothering them, or something that isn't there that they need. And when we use music, we can sometimes really help reduce those feelings, right? But again, the one challenge is sometimes knowing if it is pain that the person is experiencing, because they can't always tell us, right? So, I mean, that's the one thing I found challenging. And so it's very important to know the history of a person as well when you're working with them, so that you do know some of the healthcare issues, right? So that you are looking out for different indicators as well. But I think a lot of times people really still think very narrowly about pain and think it's solely a physical manifestation. And pain really is much bigger. A pain that someone has because they greatly miss someone that has died can manifest itself, as we know, in the body. People can experience pain, they can lose weight, they can lose engagement with the outside world. And so I think we just need to think about pain in a bigger way, and music therapy can help with that.
So, Julia, there's a lot of research that supports the concept of music being helpful for pain. When we look at the different biological systems that are affected, what is the effect of music on the nervous system that helps modulate pain?
Yeah, absolutely. So we all know that music is able to affect our auditory system, but through our auditory system, a really interesting study I read by Xiao et al., published in 2023, found that music is really able to regulate our autonomic nervous system. And through our autonomic nervous system, we're able to regulate our blood flow, our heart rate, and some of these factors can be really crucial for creating a constructive environment for healing at large. So, for example, music can increase the excitability of our parasympathetic nervous system, which is known to decrease pain perception, as well as decrease activation of the sympathetic nervous system, which is associated with inflammation and an increased perception of pain. So, by modulating these two systems, we're able to control our perception of nociception and ultimately the pain we experience.
What is the effect of music on the cardiovascular system?
Music can widely activate the brain network and increase blood flow of intracerebral arteries, therefore providing a favorable environment for overall recovery of the brain, which is beneficial for healing because when we have more blood flow, we're able to have more factors that are important for healing flowing into the damaged areas in the brain. And on top of this, we know that this has an effect on our stress levels, which we've talked a lot about how pain is not just nociception and there's many factors. So if we're feeling more calm and relaxed, this is definitely going to have an effect on pain. And then on top of this, music has a big effect on the remodeling that occurs in our brain. So this study actually found that the intervention group, which experienced music therapy compared to the control group, their corpus callosum of their intervention patients experienced much more remodeling and fiber bundle growth than the control. And although it should be noted that the study had a very small sample size, and this maybe highlights the research that needs to be done in this domain, so we can't draw larger conclusions concretely from this study. It shows where the research is today. But I think it's maybe better to look at it like it's not impacting any system independently. Everything works together.
Okay, thank you, Julia. Amy, so I know you do a little bit of work on neurological music therapy. Music also has its effects on the neurological system. What do we currently know about how music can affect neuroplasticity and even mobility outcomes?
Music does change the brain, right? So music creates new pathways in the brain. The one really exciting thing about music and rehabilitation in particular is that, for example, someone that maybe has lost some of their language due to a stroke, that pathway is broken, can then, through some variety of techniques, regain and build a new pathway. So they may have lost the ability to speak, but by building a new pathway in the brain through music, they may be able to regain some of that function. What we've definitely seen with Parkinson's patients, for example, is that auditory stimulation can help reset that clock, that function. So someone that has Parkinson's that might shuffle their gait, when they're exposed to music and an external beat, can synchronize with that beat. And so music is definitely impacting what's happening in the brain and building new pathways. There's research, which is a whole other show and topic, that looks at how the brains, for example, of people that engage with music, that play a certain number of hours or rehearse a certain number of hours a week on an instrument, how their brain might look different. And then there certainly are studies that show that different areas of the brain are lit up when we're listening to music.
You mentioned a little bit about singing for health and wellness in the population with dementia. What exactly is health and wellness do you study in this particular question?
So thinking about health in a very holistic way again, right? So I believe in those studies, I was using Hetler's theory of health and wellness. So looking at all of the domains of health and also the social determinants of health, like everything that leads a person to health and wellness. So someone can be physically well, but have a lot of other issues, right? And so they're not necessarily experiencing wellness. And someone can also have a number of physical issues but be considered well. right? I have this debate with the students I teach in gerontology, like, what is your definition of health? And sometimes people think, well, it's the complete absence of illness. Well, that's pretty rare that someone has no issues, right? So it's more about wellness being that you're able to manage what you have in terms of your healthcare, and music is there to help support that. So, for example, I think almost everyone has anxiety to some degree. What ends up happening with someone that develops an anxiety disorder, for example, is that things get shifted so much to that one side where they're not able to control the anxiety. And then that becomes a challenge in their everyday life. So it may impact what they're doing, their daily function. But we all have a certain amount of anxiety, and we all need that. It means we care about things, that we have a vested interest in them. And music can help us maintain that wellness, and it can help bring people back. This is just one example. So someone that may have more anxiety, we can use music and help them so that it's more in the wellness domain, that it's not debilitating, but that it's part of their practice, right? So that the anxiety is in control. And then I think of wellness just very much in a preventative way as well. There are studies that look at the use of music in helping reduce sick time, for example, in people in the workplace. So I think a lot of people use music without thinking about it. Like, you're listening to music, people have playlists. So what I really encourage people to do is to do that, but think also consciously about what you're doing, because everyone can have music and wellness in their life. Think about, why not take a 5-minute music break instead of a 5-minute coffee break if you really need that in the day? And if that music helps provide you a sense of overall wellness, is contributing, as opposed to maybe adding more caffeine and sitting down for a few minutes. So I'm not saying to take that caffeine away. I wouldn't take my own away, but it's thinking of using music intentionally as part of your daily practice, as part of your week, just like you brush your teeth.
Yeah. I've come across some evidence how intentionally listening to music, just listening, doing nothing, increases heart rate variability. And that's a measure of cardiovascular health. So that's certainly interesting. I was curious, though, whether you think there are particular effects on the biophysiological system from singing music instead of just listening, singing. Does that make a difference?
Yes, yeah, for sure. I think, there are hormones that are getting released. We're activating the response, the relaxation response. So people feel more relaxed, right? Just think about the fact that to sing, you actually have to oftentimes sit up. That's part of the instruction, and you actually have to take in deep breaths. So you're bringing in more oxygen, you're relaxing the body in doing so. You're often opening your mouth more, like it creates endorphins. And so we can actually feel that high from singing, and we feel bonding with other people. So I believe very much in that benefit. And I think we just don't think about it because it's so simple. Like, people sing in the shower. For me, if I am driving, and I mean, obviously I'm a singer and I like to sing. If I hear one of my favorite songs on the radio, my mood is different. Like, if I'm tired, and I'm trying to get going and it's been a busy morning, and then I hear one of my favorite songs, like, I'm a totally different person, and it puts me in a good mood. And so if I do it intentionally, it can have that benefit too. This is spontaneous. That's great. And sometimes we help people put together a playlist, for example, that's intentional, that's going to help increase your heart rate, decrease your heart rate, because we know that all the body functions follow. If I decrease my heart rate, then my respiratory rate, my brain wave is going to decrease. So that can sometimes be very helpful with pain as well, and helping people sleep. If people have trouble sleeping because they have pain or anxiety, we can help them by using music that slows the brain wave down and hopefully gets you into a state where you feel more relaxed and will help you fall asleep. So music can be very prescriptive in that way as well, very functional in terms of how we slow music down or speed it up.
I think that would be very helpful, because there are people who, because of the pain, find it really hard to fall asleep, right? But using an external mechanism, music that you like, to almost like manipulate a little bit of the heart rate response and your mood and calming things down to help people fall asleep would be a very helpful tool for someone having chronic pain and trouble sleeping. And I was almost wondering, like for singing, if I'm just thinking in my mind, right? Like if listening is not enough to distract you from the pain, can singing along your favorite song almost be something that you engage in, something that is pleasurable and just totally distract you from the pain?
It's the active, like you've got more benefits. There definitely is benefit from passively listening to music, but when you're actively engaging, you're engaging your body a lot more than just simply listening, right? So you are having that release of the oxytocin. And I believe there are more physical benefits and more benefits from actively engaging. But again, it depends on where a person is at and what their issues are. You know, like if it's someone in palliative care that doesn't have energy, then that receptive experience is important and what's going to help them in their experience. So again, it really has to be client-centered. So we do use a variety of very active to more passive opportunities, which all offer benefit, depending on, again, what it is that we're working on, the goals.
A couple more questions that are just more music therapy in general. How long does the effects of music therapy last? Do they need to access music therapy regularly to receive its benefits, or it's kind of like cumulative, you can stack benefits on top of the other?
It's another wonderful question. And again, it's not universal. So definitely some of the benefits for someone that maybe has a cognitive impairment, maybe those benefits are not lasting for a long time after they engage in the session. So it's important. Attention span may be varied, right? They may benefit much more from a 20-minute session as opposed to an hour session that someone else might benefit from. So these are all important things that a music therapist should consider and do when they're planning. I think also as a therapist in general, our goal is not to keep people in therapy forever. That's not what therapy is for. So certainly a focus for me and many therapists is to also help people build in tools so they know how to use music without the music therapist. That we're teaching people how to use music in their day as well. So that if, say, for example, they do have the anxiety and it's debilitating and we begin working with them in inpatient mental health, maybe we're going to try to explore some of the reasons why they're experiencing that and get to the core beliefs of where that's coming from and what's precipitating it. And then also, how can we help build tools in them so that they know how to manage the anxiety? So I do believe that there are long-lasting effects that come from engagement in music. And sometimes they're shorter lived things that people are experiencing in the moment, but maybe don't retain as well, or they're not as long lasting.
It's interesting to hear that we have both long and short-term effects in music therapy. I'm wondering how you track these effects and what outcome measures you might use. Do you use questionnaires? Do you use the VAS scale?
For sure. So again, really depends on what therapists and where they're working. But yes, therapists sometimes use visual analog scales or have people rate certain things on Likert scales from 0 to 5, what their experiences are. We might have our own observation checklists that we're ticking things off if we're seeing things, if we're not seeing things. We again refer to our goals. So the goals might very specifically say that this person will do this particular activity 3 times within 5 opportunities. So we can actively track things like that. And then sometimes it is more qualitative in how we're analyzing that. And so we're collecting feedback from the person on the experience. Really depends what they come with, what their goal is, how we track it, who the client is, what they're able to tell us. Again, when I work with dementia, it becomes challenging to find tools that allow the person to really be rating how they're experiencing that. And so it's not always as easy in those instances to really know for sure if someone's pain has reduced when we're not sure they understand the question. So it really does depend on who we're working with. But definitely there are different ways of measuring that and then doing research. And especially, some of the research that I've done using that phenomenological approach of what is this experience like for you? And I think one of the things music therapists don't always do the best job, and I'm guilty as well sometimes, is really describing the music that's happening in the session and what we're doing, because that's what's making the change and it's helping. And if we don't describe that a bit more fully, how can we expect people to understand why it's working or what really makes it work? I think one thing that's also very unique to us as music therapists is that we are able to work with people from so many different cultures and to be culturally responsive and try to provide music that is culturally sensitive, that is relevant to people. Because if I grew up in an area where it was Western music and I live somewhere else now and they're using other styles, it's not really necessarily going to be congruent with me and may not have the same benefits that perhaps music that I'm familiar and comfortable with will have. There's a certain amount of music impacts us, right? Arousal, for example. And so something that is novel gains our attention. But if it becomes too challenged or complex, we may not prefer that kind of music. And so then it's maybe not going to have an impact on this person, whereas it might on someone else. So the big question that people always ask me is, what's the most relaxing music and what should I be using to help me relax? I can't really give you an answer. You know, if you like heavy metal, you might actually think that's really relaxing. And someone that likes classical might like that. And, you know, for me, I like so many varieties of music, including hard rock. And sometimes that's really therapeutic for me to hear that loud banging, music. But we do know, again, like all of you were talking about today, that we can manipulate music in terms of slowing it down, speeding it up so that we can impact and try to help people have responses in different ways. But those things are so important to consider in terms of providing music that is inclusive, that is culturally relative to people. Again, that's all goes back to client-centered.
And so you mentioned listening to slower wave music to slow things down, maybe to help patients fall asleep. I'm wondering what the benefits of maybe more fast-paced music could be.
For sure. Think about many people use music to exercise. So it's motivating. So if you're having a hard time going to the gym and then the music is pumping, your body entrains to it. A lot of times we don't even know what's happening, right? Yesterday, for example, my daughter performed and I didn't even think about it. It's an upbeat song that she sang and everybody in the audience started clapping along. It just because that was the automatic response. It was catchy and had a steady beat. And if you think about it, a lot of times your body also, like you tap your feet, you don't even realize it. So there are benefits in terms of providing motivation for people. It can help maybe if we want to get someone ready to go and write a test so that we're kind of revving them up. We don't want to get them too excited because they have anxiety, but we want to maybe bring that level up as well. Maybe someone that has a lower mood might be helpful to try to shift that to a bit of a faster pace to see how that might make them feel. So again, a lot of times we're using music the other way as therapists, trying to slow things down, but it could be, even in palliative, I've had people that they're sleepy and they desire to be awake because they're going to visit with family. So it might be providing music that's going to kind of help bring that up so that they are in that state where they can maybe have a better visit, a more meaningful one.
Yeah, talking about like how just even tap along the music, not even realizing. So right now I'm in my last placement and with one of my patients, he really likes Beatles music and he do much better in physiotherapy when the Beatles music is in the background, whether that affected his mood or affected his ability to concentrate. And then we sometimes move along the Beatles music that he finds really joyful. And then, there's a smile on his face. And then with another person, we're working on stepping on the spot and playing her favorite music. She was so happy to be stepping along the favorite music. So even just that aspect, I'm not a music therapist, but physiotherapist using music when that's patient-centered, that could be, I don't have any research support myself, but could be beneficial in that sense.
Yeah, it's just another external stimulus that's helping give us some motivation, right? And I think it's very powerful in terms of how simple things can be, but yet the benefits that can come.
Yeah. I was curious about the self-management piece. You talked about how we don't want to keep people in therapy forever and we want to equip people with the self-management tools to use music as a part of self-therapy. Is that a prescriptive process? Like you teach them what kind of music is helpful for what? What does that look like? How do people use music to manage their symptoms or their conditions?
So again, it really looks different with whoever you're working with. Sometimes it can be helping them like be very practical in terms of helping them build a playlist. Like, how do you go about building a playlist that is specific to help motivate you? So there's an example of how we might be using music that gets increasingly faster. So it's got a purpose and a trajectory. We might be helping them create a music playlist that helps connect them to identity. If they start to feel lost, like, what are the 5 songs that are going to help you maybe think about these positive characteristics of yourself? So it could be very practical in that we maybe help them learn how to do it and we work on one together. It could be helping people use music to avoid triggers or to help them manage their week. So it could be that we suggest they engage in a certain amount of music during the week, or it might be more, when you do feel these feelings coming on, can you use music to help reset yourself? So again, it kind of is dependent on what the person needs, what kind of their issues are. And I think it becomes more about how do you use music than necessarily prescribing it exactly, like you're going to do this, this, and this. But there's a whole thing now about social prescribing. There's a lot of research in social prescribing. I myself have written a little bit about it. I'd like to see more of that, where we're not simply having people go to the doctor and they talk about having lower mood and so they get a medication. That medication may be very important, but sometimes people are not getting to the core reason why that person has those feelings. And so it could be maybe part of it is loneliness, is social isolation. So maybe a social prescription is to join a choir and go and engage in that, right? So I do think there's not a lot of research. I did some scoping review with others looking at music for and social prescription and particular singing. But I'd like to see more of that, using music as part of, again, this holistic care package, as part of healthcare management, not just having medications, but what other things can be part of wellness in our day.
So, as physios, if we think, oh, this patient might benefit from having music therapy or even learning about how to use music for self management, how would you suggest us go about bringing this up? And what are the resources we can point them to? Is it like a music therapy consultation?
Yeah, I would suggest that if it's possible to refer them to a music therapist that maybe could do kind of a consultation. I know I've done that with caregivers where I've talked about putting together like a little care package for them. So if they are supporting their loved one that is at home, maybe with dementia or other healthcare issues, kind of talking them through like, what could you do to help? How could you use music in the day to help that person? So it's more of a consult and sharing. For someone that wants to learn about music, again, like perhaps they're having trouble expressing how they feel, or they're not drawn to talk therapy, or so many different reasons they may engage in music therapy. And part of that process might be to learn the tools that they use for themselves as a way of bringing the therapy to a closure. So it's not that that's always a goal. It really depends who the client is, why they're coming to therapy. If it's short term, if it's acute hospital setting, it might be very much just helping them with the symptoms they have. There's no time for that kind of education piece. But if someone is coming to us in the community, maybe that's part of how we're not keeping them in therapy long term. And there's also other opportunities like having them join a group. For example, a group experience could be helpful. We didn't actually touch on that, but people come to individual as well as group music therapy opportunities. And can be very similar goals, but it could also be very different why someone comes to a group environment as opposed to benefiting from individual.
Mm-hmm. Where would you find these group therapy?
It really depends where you are located, what country, what province, if you're here in Canada. If you are in like a long-term care facility or you're in another clinic, those groups might be offered there, like they might be offered in a community center. Typically, it's a lot harder to find a group kind of independently of that, right? That typically they're offered in those kind of organizational settings. Music therapists can offer a group in private practice, but it's a little harder, I think, for people to know, to find out about them. So they tend to be more offered in the community and through like partnered attempts, right? So that more people become aware of the opportunity and that sort of thing.
what would be some barriers to people responding to music therapy?
Yeah, so it's very important to also think that music can be harmful. While I believe wholeheartedly music can help many people, it's not indicated for absolutely everyone. So, for example, thinking again about being culturally responsive, there are definitely times when music is not appropriate because of different beliefs. For example, maybe during the grieving process, maybe people are not to be listening to music for a period of time. So, of course, then it's contraindicated. Other times, if the music is too harmful for someone, like it's causing more harm to listen, they're not at a stage of engaging in that, then maybe it's not the right time. And certainly, if someone is not responding to music, we don't keep them. If we're doing our job and we're trying to engage them, but they're not responding in a way, it may not be the therapy for them. So it is important to think about the harm that can be done if we're not using music that is culturally relevant, that maybe is not indicated, that goes against someone's values or making assumptions about that. So it's very important to be very responsive as the therapist to seeing. And so music therapists do have to be trained as musicians and to be good musicians, to be able to improvise in a variety of styles, to produce music that is aesthetically pleasing, because no one wants to be engaged in an experience that is not pleasant. That's obviously not going to help anyone. So, and let's face it, I can't authentically recreate all music. It's just not possible. At those opportunities, that's when I know that maybe something recorded might be more appropriate. I can't sound like Louis Armstrong. I can certainly sing Louis Armstrong music, and I do all the time, and people enjoy that, and it has benefits. But if someone really is desiring to hear Louis Armstrong, then they should hear Louis Armstrong. Like, yeah, I'm not going to cut it in that realm. So,
I'm curious and wonder if you yourself have changed over the years how you practice music therapy, how you see music therapy.
Oh, for sure. I knew from quite a young age that I wanted to be a music therapist. I had an experience where I did a co-op placement, and I saw how music helped some of the clients with dementia engage, right? People that didn't know who I was from week to week would brighten up and start singing songs that I sang with them. And I saw that music was connecting us and was bringing out that person. And I was hooked. I thought maybe I wanted to be a music teacher. I wanted to be a performer. But then this was just too impactful. I knew that I could use music and also engage people in a variety of health goals. So I became very passionate. And definitely, as my skill increased, I've changed. And I believe all therapists need to be on this path of continual learning, because what we did 10 years ago, we might not do today. We're always learning. So my approach has changed. What I do has changed. My skill set has increased. So I have more opportunity of things that I would invite. But what I never lose sight of, and I'm so privileged to be an educator and a supervisor, is that young professionals come with amazing ideas and opportunities. And so they also then become part of my praxis, where they think of this great idea and I'm like, oh my goodness, that's amazing. Can I use that? So I think my practice is always changing. So I think at the heart of it, though, it's always been relationship, and that has not changed. It's always been about using music to make that connection with someone else. And I don't think that will ever change for me.
So I was wondering how music therapy functions in interdisciplinary healthcare team. Is it something that's more standalone, or do you find yourself collaborating with other healthcare professionals?
Again, so varied. If we're in an institution organization, we often have more opportunity to collaborate in a team, to be setting goals as a team, to be working on things together, to augment what someone else is doing. So I might work with a client and find out what they're doing in speech pathology, because maybe I'm going to do something similar or augment that. Certainly in research, sometimes we have research that's very specific in music therapy, but a lot of research does involve interdisciplinary teams. And I'm very much a proponent for that, because I feel like we're gaining the expertise of different professionals when we're designing a study, and it can often be more robust in terms of the design. and the different specialties. So we do prefer to work in interdisciplinary teams. It just doesn't always happen because many music therapists are on contract. So they may just be contracted to go in and provide a group. And so they don't have that opportunity. And the team often then doesn't know what they're doing, which is unfortunate. And so we need to see music therapy more fully integrated into our healthcare system.
So I guess that brings us into what you're looking for music therapy going forward.
What I would love to see is government regulation of music therapy. And at different parts of the world, music therapy is regulated, is certified. We have a credential, right? So you do have to go through a credentialing body and write an exam, but it's not recognized by the government. So there's no government funding that is specific. And that makes a huge difference in healthcare. When music therapy can be funded by, say, OHIP, which it's not, it becomes less integrated. So then we are missing out on serving a lot of people that can't afford to have music therapy. And that's a huge issue for me. So when I design studies or when we work with students, we often try to provide music therapy to people that maybe don't have access, that can't afford that service. And those people are often the ones that really need the service because they're often not benefiting from other things. And so that's a really big issue in terms of where music therapy needs to go. And I'm constantly advocating. I have been since I started in this career, and I feel like I will till I die, advocating for us to be more integrated into the healthcare system. So that really needs to happen. And it's happening slowly, but too slowly as far as I'm concerned, because we're missing out on helping a lot of people. There is a great body of music therapy research already out there. People just don't know about it, but we still have a lot of research to do, indeed. We are very fortunate that actually, because of the pandemic, the profile of music and its role in health and wellness was raised. People became a little bit more aware of it. Now that the pandemic, has passed, people are not maybe so aware of it. But that helped us in terms of there's been some great movements, especially in the United States, with the National Institutes of Health having large grants now that support music and health-related studies. So we need to see more of that in Canada and in other parts of the world, because that's going to fuel people's understanding of how we can be using music in all aspects of health and wellness care.
Yeah, indeed. The body of music therapy research is larger than I expected. Like when I had the idea of having an episode on music therapy for pain, I was even like, I don't know if I can find any articles on this. And there are indeed quite a few articles, and which we can link in the show notes for interested listeners to refer to. And hopefully through this podcast, more physiotherapists will be aware of the benefits of music therapy, and I can spark something more collaborative care on a personal level, and then, as you said, eventually on a systematic level. Entering the concluding part of the interview, talking about future directions of music therapy, we talked about the advocacy that is ongoing. I am curious in terms of the research side of things. You mentioned briefly the vibroacoustic therapy, which University of Toronto is spearheading in this area, I think, from what I read. And what else are you interested in looking at?
Yeah, so right now, I definitely am working with some different teams, so interdisciplinary teams, which is great, looking at, again, advancing our understanding of singing with different populations, with people with communication disorders. There's other research that has sparked that I've become interested in terms of telehealth and how we can use music in terms of providing telehealth to individuals to help increase access. So we need to learn more about what makes telehealth beneficial, who it benefits, who it doesn't benefit. So the more efficacy of using that and developing its praxis, because it's different providing telehealth than it is in person. So that's of particular interest to me in developing more understanding around telehealth. I'm definitely interested in learning more about palliative care and the experiences of music therapy in bereavement, where we don't have as much literature in that area. And in supervision, that's some research that I recently did, and a scoping review looking at that. My head's in a lot of pockets, but I think we definitely want to be looking at holistically how music can help in the different domains with I mean, it helps with so many different populations, but it might be that we focus in on some very large areas like dementia. Dementia care is an area that requires so much attention. By 2050, the amount of people with dementia will double, and we don't have the supports in place right now. It's looking like we're not going to have the supports in place by 2050. And using music, for example, this tool that is cost effective, it should just be there. It shouldn't be an afterthought. It should be part of this comprehensive package in care. And so I think that's also where my head is going in research in terms of how can we integrate ourselves more into the healthcare team and be part of that core package that people experience, right? There's always more studies that we could do in terms of proving that music works and, having lots of statistical significance. But the challenge is that we already know it works in so many areas, but we don't always understand how it's working or why. So that's my big thing, is that I'd like to learn more about that, because that's how we're going to help people. And sometimes that means more case studies, which you can't generalize, but it's helping to refine techniques, maybe do some more protocolization. There's just so many areas we could be expanding in, depending where we're working.
That is exciting.
Yeah, it is.
Many things.
It's very exciting. And sometimes my head, I get too excited and then I can't decide where I want to focus.
We have a little bit of time, but I'm wondering if we can touch a little bit about vibroacoustic therapy. Like, this is a word that perhaps will be new to many of our audience, but just briefly, what is this and how does it work?
So vibroacoustic therapy is this idea that sound stimulation is going to help us with wellness, right? So it might reset neural oscillatory coherence in the brain, right? And so there is research that's been done with different populations. So for persons with fibromyalgia, for example, the studies that I did a couple of years ago were with individuals with dementia, where there hadn't really been research in that area before. So looking at how we could maybe use this 40 hertz brainwave activity to help one part of the brain communicate with the other part of the brain. So for people that have Alzheimer's, some of that brain activity is depleted. So this 40 hertz wave that people are experiencing is going to help one part of the brain communicate with the other part. So we're hoping that it might help with increased cognition, clarity, and these are things that we saw in our small pilot study. So I would love to have funding to do a much larger study with brain imaging. That hasn't happened at this point, but I think that would be the next stage in terms of dementia care. But definitely the vibroacoustic has been looked at in terms of helping people with pain and helping people with mood as well, as a variety of other healthcare issues.
Cool. Glad that we touched on it a little bit and something up and emerging in the literature. Any final thoughts before we end the recording?
Hopefully I've encouraged people listening today to consider using music for your own health and wellness. Just think about it more intentionally, because there's so much value in the different music experiences, and it's really simple to integrate that into your day. And I thank all of you for inviting me to the Paincast to talk a little bit more broadly about what music therapy is, and to also consider that pain is very much not just physical, but that we experience it in many realms as well. So thinking very broadly about that and how we can be using all of that allied healthcare professions to assist.
Great. Thank you so much for spending your time and sharing so much about music therapy and sharing your passion of music therapy with us.
My pleasure.
Thank you for listening to this episode of Paincast on music therapy for pain. I hope you learned a lot. Paincast is a freely available resource to help you learn about pain and physiotherapy. To support our podcast, please subscribe and rate it on Spotify or Apple Podcast and share it with your network. You can also use the feedback form linked in the show notes to help us improve. Thank you again, and stay tuned for future episodes on pain and physiotherapy.